You may think of wounds as minor inconveniences, but for the 1 in 14 British people living with diabetes, they can have dire consequences. Roger Dunn, a 47-year-old man with diabetes, is one such example. After wearing poorly fitting shoes to a friend's wedding, Roger developed a chronic foot ulcer that landed him in intensive care. The wound had become infected, ultimately spreading to his blood. Roger narrowly avoided death, but many others are not so lucky. Roger's story is part of a hidden health crisis sweeping the UK and the world more broadly. 2 million people in the UK alone endure chronic wounds, which take months or even years to heal. People with diabetes are particularly at risk because the disease compromises their ability to heal and resist infections. Approximately 1 in 3 people with diabetes will develop a chronic ulcer like Roger's. Most ulcers will become infected, and even a minor infection can rapidly spiral out of control, leading to hospitalization, amputation, and death. Most chronic foot ulcers are managed in the community by district nurses, but available tools are rudimentary, with nurses visually assessing wounds and making subjective judgments. But early warning signs can be tough to catch or hidden beneath the surface of the ulcer. We developed Stratum for predictive, preventative, and personalized care. Stratum is a handheld imaging device and connected digital platform that modernizes community care for chronic wounds. It also integrates with our smart bandage for advanced remote monitoring. Our handheld device allows home care nurses to instantly access actionable insights and treatment recommendations that are powered by tissue characteristics analyzed from deep within the wound. This advances wound assessment into an entirely new space, driven by objective data and validated science. Meanwhile, our digital platform streamlines clinical workflows. Patients are often treated by a different nurse each week, making it difficult to monitor wound history progression. Stratum automates wound assessment and documentation, making it easy to track progress over time and make informed decisions. In between nurse visits, our flexible battery-free smart bandage monitors the wound for early signs of infection and notifies patients and clinicians if they need to intervene, thus preventing infections from escalating beyond repair. Over time, our platform will illuminate the hidden mechanisms behind wound chronicity. By crowdsourcing data from thousands of wounds, Stratum will construct digital wound models, allowing it to simulate disease trajectory and deliver personalized care. Through partnerships with academic institutions, the knowledge generated by Stratum could even engender breakthrough discoveries and treatments, revolutionizing the way chronic wounds are healed. Stratum will immediately empower the highest quality of care possible, changing the course of people's lives.